Hey, Dr. Ebert. So my skills are ankle range of motion, dorsiflexion, and plantar flexion with the goniometer, cut, knee extension, mobility testing of the first MTP, joint mobilizations, posterior glide of the femur on the tibia, and the ankle anterior drawer test. It's my boyfriend Peter, and he will be my patient. So, Peter, can I get you to lay on your stomach for me, please?
Sure.
Okay, can you bend this leg up for me? Alright, so the most thing I want you to do is to point your toes like that, like you're pressing on the gas pedal. Good. Alright, relax. Just lining up the goniometer. I'm using the small one because I don't have the big one. The lateral malleolus is the axis of rotation. The moving arm will be in line with parallel to the fifth metatarsal, and then the stationary arm is lined up with the head of the fibula. Alright, so can you to point your toe again? Good. Alright. And Peter has 40 degrees of plantar flexion on his right side. Now I'll just put this one down. The same thing over here. So can I get you to point your toe for me? Thanks. Relax. Okay, one more time. Okay, and he's got 39 degrees on this side. Both of those are normal. So now, dorsiflexion range of motion. Alright, Peter, so what I want you to do is bring your foot down like this. Just like that. Okay. You can relax. Alright, do it for me one more time. Hold it there. Wait, I have this backwards. Okay, sorry. Do it one more time. Point down. Thank you. Okay, and he has about 9 degrees of ankle dorsiflexion on the right side, which is within normal limits. Right. Same thing over here. Yeah, point it down this time. Good. You can relax. Alright, now put your toes down. Good. And on this side, it's about 8 degrees of active ankle dorsiflexion. Okie dokie. I think now is cut testing. Yes, of knee extension. So, Peter, can I get you to roll over onto your back for me, please? Okay, so this is just actually lay with your head down that way. Yep. This is just testing the strength of your quad muscles. I want you to let me know if you have any pain with this. Okay? It shouldn't hurt. Alright, scoot closer to me, please. Okay, relax. So bring your leg up about right here. I'm going to try to push your leg down. Hold it here. Okay, I'm going to try to push it down. Don't let me do that. Alright? Let me know if you have any pain with this. Good. Relax. No pain? Good. Same thing on the side. Right? Here. Hold this position. Don't let me push your leg down. Good? Mm-hmm. Any pain there? Alright, so I'd say for both bilaterally, Peter was strong and painless for knee extension. Okay. So now mobility testing of the first MTP. So Peter, what I'm going to be doing is assessing the amount of motion, the integrity of the motion, quality of your joint at your big toe. So I just want you to relax. Currently doing a posterior glide of the phalange on the first metatarsal. Now doing a anterior glide. Do you have any pain with that?
No pain.
Same thing on the side. And I'm not feeling any grinding or clicking sensations within that joint. So I would say that it is normal. Alright. Okay, so joint lobes. Okay, so now doing a posterior glide of the femur on the tibia, which is what you do if you want to improve closed kinetic chain knee extension. So first, before I do any modes, I'm just going to assess amount of motion at the joint. Alright, so grade 1, 0 to 25% of the motion. It's a little quicker. Grade 2, 0 to 50% of the available range of motion. It's a bigger range. Grade 3 is 50 to 100. And a grade 4 is 75 to 100. Do you have any pain with any of this? Okay. Okay, so same thing on the side. I'll first just assess motion. Okay, so grade 1, 0 to 25. Grade 2, 0 to 50. Grade 3 is 50 to 100. And a grade 4 is 75 to 100. And I think finally we have anterior drawer test. Alright, so you can sit up with your back against the pillows if you'd like. Okay, I just want you to bend. Up. So right now I'm testing, we're about to test the integrity of your anterior talofibular ligament, which is a ligament that's often incriminated in lateral ankle sprains. Looking for a sulcus sign. So just relax. Let me know if you have any pain with this. Any pain? So Peter did get a sulcus sign on his right foot, but he didn't have any pain with it. So I would still say it's a positive test, but note that it was without pain. Okay, so you can put this one down and this one up. Any pain there? Same thing on the side. Also had a sulcus on his left foot. So I would say it was positive, but without pain. Alright. That's a wrap.